advances in healthcare run the gamut, from mind-boggling medicines to simple web solutions that, if adopted, could slice huge slabs of fat from a bloated system. If President Obama is able to pass a stimulus package early next year, rumored to be about $850 billion, it could be a boon for the healthcare industry. The Washington Post has reported that there are plans to allocate upwards of $10 billion to implement a nationwide interoperable electronic medical record system, or EMR. The investment could jumpstart a flurry of spending on health information technology. The CBO released a study late last year estimating that the implementation of a health information technology system, including EMRs, could save up to $7 billion in the first 5 years alone. The end result is a future in which healthcare is more personalized and frequently delivered outside of the doctor's office and hospital. Whatever form innovation takes in the coming years, much of it will spring from startups, not pharma and tech giants. All of that spells huge opportunities for tech-savvy startups and new hope for sick patients in need of better and less expensive care. Our guests today are exactly the type of mavericks who are redefining the healthcare industry through their innovative and cutting-edge inventions and revolutionary business models, and most likely the type of entrepreneurs that the Obama administration hoped that their healthcare reform would unleash in a rapidly transforming marketplace. Today we'll meet 3 organizations who are blazing a path towards this new level of personalized healthcare for a multitude of constituencies. Let's meet them. First up is Mr. Richard Lopez del Rincon, Executive Vice President of CareCloud. CareCloud is a cloud-based physician and hospital medical practice management platform that allows physicians and administrative staff to hold every aspect of the practice from patient scheduling to claim submission seamlessly. CareCloud has been revolutionizing the practice management industry with the idea that physicians who embrace the technology enable future practice management will run more profitable practices and deliver better patient care, while physicians who cling to antiquated systems will rapidly fall behind. Next up is Mr. Bernard Lee, the Executive Vice President of Activ Doctors Online. Activ Doctors Online is a revolutionary concept in the field of electronic medical records, which usually focuses on hospitals and doctors having access to patient records in a digital format. Activ Doctors take that very concept and turns it on its head and provides patients with the power to control their own medical records through a cloud-based patient health records, or PHR. Activ Doctors goes beyond the basic EMR system by allowing patients to consolidate their health history and medical records from different specialists or hospitals and store them in one place and access them from anytime, anywhere, from any location. Finally, we have Mrs. Penny Schaefer, who is Blue Cross Blue Shield of Florida's market president in South Florida. In this role, Mrs. Schaefer is responsible for BCBF's business operations in Broward, Martin, Miami-Dade, Monroe, Palm Beach, Lucey, Okeechobee, Indian River counties. Blue Cross Blue Shield of South Florida is a subsidiary of the Blue Cross and Blue Shield Association, a national federation of 39 independent, community-based and locally operated Blue Cross and Blue Shield companies. Collectively, the Blue Cross and Blue Shield system provides healthcare coverage for more than 98 million people, or 1 in 3 Americans, nationwide. More than 90% of hospitals and 80% of physicians contract with the BCBS companies, more than any other insurer. Thank you all for being here. All right, so we're going to get right into it, and I really want to have a good conversation about the healthcare system and how it's being changed almost overnight. Let me start with you, Mr. Del Rincon. Tell me a bit more about CareCloud and how the idea came out to roll up a medical practice management into a cloud-based system, and how does it work for practices?
So, one of the biggest challenges today in the physician offices is that they're not connected. They purchase software. This software resides in the server inside the office, and it really doesn't allow for patient connectivity, doesn't allow for other physicians to connect with them, et cetera. So being on the cloud, the physicians are innately very mobile individuals. They're in the hospital, they're on the go, they're going to nursing homes, et cetera. So allowing it to be on the cloud, they can access it from anywhere. Their patients can access online the practice, pay copays, deductibles, ask for prescription refills, get appointments, requests, and the staff can now collaborate with patients with doctors, and with other practices. So the cloud is the perfect mechanism to allow really a very collaborative institution of healthcare to really communicate well with one another.
So, in looking at the cloud, are you seeing physicians migrating to the cloud seamlessly, or is there some reticence for them to go from a paper-based process and moving towards more of a digital process with the cloud?
I think the biggest challenge is that physicians can't be slowed down. They're having enough struggles with reimbursement, et cetera, and seeing one less patient a day, or seeing a patient inefficiently and potentially causing, for instance, drug-to-drug interaction, et cetera, is something that they can't have. They need to be able to prescribe the right medicines. They need to be able to see drug-to-drug interactions. They need to be able to be efficient. And the challenge with moving to a digital-based system is that some of them are reluctant because they think they're going to see less patients. However, we've really spent a lot of time on usability and design so that the physician can see as many patients, if not more patients, in the same amount of time. And then the patient wins because, once again, one of the things you mentioned in the introduction was all of this money. And money's important.
Right.
But one of the key components of electronic medical record is really reducing deaths in the United States. So let's talk about the patient, let's talk about getting better care, and let's also talk about the financial impact. Because we really try to impact not only the financial and clinical aspects, but also the administrative aspects of running a practice and make it much more modern.
That's awesome. Now, talking about patients, I wanted to turn to you, Mr. Lee, and the idea of a personal health record. Now, why is a PHR very different from an EMR, and why should somebody say, look, let me handle my own personal records when my doctors or the physician or the hospital already handles that? What makes your practice so different?
Well, when you just look at personal health record versus an electronic medical record, as we know, in 2014, it's going to be mandated, it has been mandated, in which physician practices, doctors, hospitals, insurers need to communicate, and they need to communicate via an EMR. Mm-hmm. Now, an EMR is all of our individual records, but it's controlled by everyone but us. Personal health records, it's my health record, my entire health history, all my physicians. I control it. I know who's seen it and why. I give them access, and it's accessible 24/7 wherever you are in the country or wherever you are in the world. Now, why is it important to have your own personal health record? Studies are showing that when you're in control of your personal health records, you're a much more educated healthcare consumer. You obviously save money because, as Rich said, this is really about costs.
Right.
30% of all spending towards healthcare is unnecessary spending, unnecessary tests and procedures. In 2006, that number was a little closer to $700 billion. As of late 2009, that number is closer to $1 trillion. So telemedicine, electronic medicine, this is all companies that have been, we're here because it's really about how can we benefit the healthcare consumer and how can we lower costs for the individual, for the physician, for the employer, all down for the state, for the country.
Right.
So companies like ours are popping up because at the end, the value proposition that we provide is going to be always to that individual consumer. How can I become a better healthcare consumer?
Now, you mentioned something that I think it definitely hits it right on the head, and it's the issue of cost, right? And I wanted to go to you, Ms. Schaefer, and talk about cost. I mean, Blue Cross Blue Shield is the largest insurance company probably in the country. And when you talk about cost and what Bernard just talked about in terms of driving the cost out of the system, how does a company like Blue Cross and Blue Shield, really start migrating consumers, doctors, this whole system, this massive change that's happening? How do you guys stay ahead of that curve and start migrating people to this new way of thinking and driving costs out of the system?
Well, part of it is about this whole concept that Bernard just talked about, which is this consumerism and making the individual a better consumer of their healthcare dollar and taking care of their health. If they understand the importance of knowing what they have, what the procedures are, what they've already had done, they stand a better chance of sharing good information from a quality perspective, but also stand a good chance of saving money. One of the examples I give when I'm speaking to groups is usually in a room of 25 or more people, and I'm guessing by the fitness of this group, I don't have to have 25, somebody in this room has torn an ACL at some point. and it probably happened on a weekend, and it was painful, and it may have gotten you to either an urgent care or a hospital. X-ray, CAT scan. Monday you saw maybe your primary care physician or maybe a specialist, another CAT scan potentially. Surgery was indicated, second opinion for that surgery, and maybe a third CAT scan. Whereas if you had the record, all those extra tests don't need to be done. So you get better care and a lower cost.
That's interesting. Well, this is fascinating. This is exactly the kind of information we want to bring out in this segment. We're going to take a 5-minute commercial break, and when we come back, I want to talk about some of the emerging trends that are happening in the healthcare ecosystem as a whole and how your companies are dealing with that. So don't go away. We'll be right back.